Thank you for coming, everybody. Yes, for the great unveiling. And we are particularly thankful to Alex and Matthew, who've been supporting this project over, is it 3 years now we've been doing it?
Yeah.
Yes. So I hope you notice that the displays keep changing. Now, I think what we should do is send out a little quiz to the people who sit in these offices, shouldn't we?
So if they actually pay attention to
and
it.
ask them if they actually know what have been on the displays and what have they learned. Yes, and will they notice it's changed? But, I'll hand over to Myles and Isabella.
Great. So
Yeah.
Do you want to introduce before I unveil? Or?
Here's our display that we made for Community Engagement SSC, and it's called Dundee, A History of Infectious Diseases. So we've kind of done a bunch of different kind of infectious links to Dundee, kind of talking about how it kind of links to the history and also some just interesting objects that we found in the archives.
Drum roll.
So we thought that by looking specifically into how this is affecting Dundee, we might be able to sort of make it a bit more interesting to people around here and give it a link to the local area, you know. And we thought we'd look into a variety of different diseases. So we looked into sort of tuberculosis, smallpox, cholera, and syphilis and the plague as well, and a tiny bit on typhus as well.
And something that I found particularly interesting was how the plague had affected Dundee. So we actually found out in the 16th century plague victims would be buried at Rudyard Cemetery, which is actually still down Botty Ferry Road, and people would be forced to be outside the eastern boundary of Dundee because it used to be a walled off area. We also learned a lot about miasma, which just means bad air. People used to think that bad air was like the cause of plague and that's how it would spread before germ theory came about. Which is why we have this little section over here that has a bunch of different herbs and spices that kind of links to that. We also found out about a potion called the Four Thieves Vinegar, and it was created by 4 thieves who thought that if they drank this, it would protect them from the plague, so they were then able to rob people's houses in different graves.
The final cases of plague in Dundee were in 1918, and they came in a ship coming from Calcutta. There were 3 cases and 2 of them died. I'm just going to talk about typhus briefly. So we found an old document about the typhus sort of death rates in Dundee in 1865 to 1866 in Dundee Royal Infirmary. And interestingly enough, the death rates here were quite significantly lower than in London and Glasgow Royal Infirmary. So in Dundee they were 10%, and in London it was 19.7% and 14.27% in Glasgow. And the person who wrote this sort of report attributed that to the fact that they treated it by giving people alcohol, which seemed a strange method of treatment, but seemed to have some sort of effect somewhere or other. Yeah, and then King's Cross Hospital, which we don't have a picture of, but we actually have one on here. That's King's Cross Hospital. That opened in 1889 as Dundee's Fever Hospital, as a sort of effort to try and separate fevers and infectious diseases from other conditions to stop the spread. And the western block of this hospital was used intermittently for smallpox cases, and there was a particular outbreak, so probably the most recent one, in 1927 of variola minor, which was a sort of minor version of smallpox, and it was used extensively then.
So another thing that we found interesting was we learned a lot about X-ray campaigns. So after they were able to find a cure for tuberculosis, in the 1900s there was a growth of X-ray campaigns, and Dundee was a place that kind of led these campaigns of doing these kind of moving X-ray vans as well, and bringing people in for screenings to try and curb kind of tuberculosis. Tuberculosis is quite interesting because it's one of the oldest diseases, and it's followed humans for over 9,000 years. Though it is like kind of viewed as a disease of the past, it's still like a leading cause of infection around the world, and it's still something that's actually seen within Ninewells.
And just an interesting random fact about TB is that it used to be associated with vampires, particularly, not quite so much in Scotland, but particularly in New England and America, I think because people that suffered from TB were so pale and sort of gaunt, and they coughed up blood as well, and sometimes people would have quite a weak pulse, so they thought that they were sort of dead, and they also had some photophobia if they had ocular manifestations of TB. And then we're just going to talk about syphilis as well. So syphilis was treated with mercury up until around the 1910s, because salvarsan was discovered in salvarsan was discovered in 1909, I think, and they treated people with mercury, which kind of poisoned them up until then, and it didn't treat the mercury at all, so people would either die of mercury poisoning or syphilis. So that wasn't a good time to have syphilis. If there ever is one. had the idea of a magic bullet in 1907, which comes from a German myth called Freischütz, which was about a sort of marksman who made a deal with the devil so that you'd have 6 magic bullets that would always hit their target. And the idea was that you'd be able to treat a disease without injuring the actual person's body. So it was kind of the sort of first kind of antibiotic. It wasn't very wide range though, so it was penicillin that was the first sort of proper wide range antibiotic. And it was synthesised by Alfred Bertheim in 1907, but it wasn't until 1909 that it was discovered to be anti-syphilitic by a Japanese immunologist by the name of Sahakiro Hata, in addition with Paul Ehrlich in their lab together. And the Japanese scientists also discovered that Yersinia pestis was the causative organism of the plague.
So overall, we both had a great time working on the display, and we've learned so much on how to curate and put together a project like this, as well as lots of information about medicine that without this project we probably wouldn't have even thought to investigate. A big thank you obviously goes to Alex and Matthew for helping us during this project, and we really appreciate the opportunity to be able to make something like this. Thank you.
Are you happy to answer questions?
Yeah.
Does anybody have any?
Would you mind giving just like a quick kind of overview of what all the different sections are,
Yeah, sure.
what your slides are?
So we've kind of got tuberculosis section up here. We've got some pathology specimens of tuberculosis of the lung, and then cases tuberculosis of the kidney as well. And then in front of that we have a patient card from the He Smallpox Fever Hospital, which was a sort of temporary hospital used before the King's Cross Hospital was opened to separate infectious diseases from everything else. And then we have some pathology slides of TB in the lung and the great toe, which are actually from 1913 or 1914. And then we've got printouts of those so you can see it in better detail. Yeah, and then the smallpox vaccine over here. That's the Cholera Hospital at the Craig, which is a sort of temporary hospital for cholera patients.
And then down here we have some of the spices to do with treating the plague and well, preventing the plague. Then here we have a slide showing plague of the lung. And then here is more about x-rays, and this is a x-ray tube from one of the mobile x-ray units. And this is a German article which kind of discusses using x-rays to diagnose TB. And then here is kind of like a bit of a corner on syphilis. We have a illustration about congenital syphilis, some vial of salvarsan.
Yes.
And then we have here some slides that show syphilis of the tongue and the brain.
You can think of one thing that you think that you've learned through this that you think all of your student colleagues should get to learn about because it will help them become better medical students and doctors. What do you think?
Well, one thing I was going to say was about the mercury being used to treat syphilis was that, like, I think up until they sort of started to make things like salvarsan and like actual effective treatments, a lot of medicine often did more harm than good. So I think that sort of taught me the importance of like making sure that we balance risk when we're prescribing things and making sure that you're not actually going to end up doing more harm than good that you're causing. Yeah.
And I think it was really important to kind of learn about how Dundee itself changed, how the different hospitals changed, and how the social factors kind of affected the different diseases that came in, like how all the industry that kind of came with the jute industry and the poor working conditions kind of led to kind of different diseases like cholera and TB being rife. Kind of how important it is to think about the environment as well as the disease.
I loved both of your responses to Jordan's question in the sense of managing risk, particularly with the stuff that we do now, and the social, cultural context of healthcare. Both of those are just spot on.
Thank you.
Yeah.
Great, that's a good place to finish. But please do stay and take time to have a look, and then the students will gather in teaching room 4 in about 10 minutes. Yeah, but we'll let people have a chance. But well done, it's really interesting. Thank you very much.